So we're talking about jobs and how they harm you.
Yes, this is we're gonna call this a snippet, a conversation between the Nubian Goddess and her daughter Lem. So this conversation is about corporation and jobs and how at the end of the day they are harmful. So whether you like to admit it or not, harmful in a way, in the sense of when you become. I feel like it's more harmful when you become a huge corporation, because then you got all these little compartments. Mm-hmm. That's what I was talking about. Mm-hmm. So when you decide that you want to take it past, when you want to take it past certain things, like for instance, working for a lot of even hospitals or corporations, mm-hmm. But like you have your business aspect of it and the healthcare aspect of it, even though both are business, just ran differently. Mm-hmm. On the health aspect of it, the business is the slaughter of patients. Yes, I'm calling it slaughter because it's literally, if you look at a doctor's schedule now, it's unethical. It is not patient care. Okay?
It's just layers of people.
It's layers of people, and you have a 20-minute slot, and it's like, get them in, get them out, get them in, get it out, get it. There's doctors who are seeing patients in less than 5 minutes. What kind of care is that?
There's not care. You can't
get them in, get them out, get them in, get them out.
You can't care for somebody in less than 20
double
minutes.
booked, triple booked. You could be double booked for 2 1 o'clocks, 2 1:20. Get them in, get them out, get them in, get them out. They want you to move fast like a robot,
And these people are coming in with ailments. They want to make sure they're okay.
And it's sad because as much as you would like to show a little bit of compassion for the folks that may come in with a serious situation going on, to an extent you really cannot, because of the fact that you're on a time limit and you need to be seeing these people in a certain amount of time, because everything is an electronic medical record. Everything's timed. Your vitals are timed. Doctors putting in orders is timed. Doctors completing notes are timed. It's time, stamp, real time. Get them in, get them out, get them in, get them out, get them in. It's disgusting. It's a slaughter. And then we're not even going to go there with the emergency rooms. You're literally waiting forever.
And it's an emergency.
Yes. So
you're in the emergency room.
Yes.
And you're not even, it should be immediate care, but it's not like that.
No. And unfortunately, one of my biggest pet peeves is the fact that they blame the workers. They blame the medical assistant. They blame the nurse. They blame the doctor. They blame the CNA or the patient care tech, mm-hmm. or the receptionist, and they blame it in like their attitudes, their this and that.
It's the system working against everybody.
Exactly. So in these big corporations, okay, they know what they're doing to make sure that they keep their pockets fat and everyone else just enough. So you got a you got a doctor that's on the floor, right? You got a doctor that's on the floor and nurses that are on the floor. And let's say you have a floor and every bed is filled and it is understaffed with the proper care of nursing. Things can happen. People get frustrated because at the end of the day, everyone feels like their emergency is an emergency. And technically, yes, it is. However, being as though you're only given what you're given, you have to determine which one is more important than the other. You understand what I'm saying? Mm-hmm. And these corporations, they know that. But at the end of the day, if they realize that they cut costs to cheaper things, even in health benefits now. Back in the day, when I first started in the medical field, girl, do you know how much I used to pay for all our insurance? Mm-hmm. Guess how much I used to pay for good ass insurance for us? $20 a paycheck. $40 a month. That's it. Now, do you know I pay over $100 a month for us?
I believe you.
Literally, and what they cover is shit.
Exactly. That's what I was saying. Insurance I looked it up. it's not the whole. I don't know if it's a whole, but they're getting more. They're getting billions of dollars. What the hell do you mean you can't pay for this?
Now imagine if they circulated that billions of dollars correctly, you would always have. And that's the thing with a greedy mindset and a scarcity mindset. There are people who have, if you circulate that billions of dollars to make it all work, you will always have people who will want to work for you. People who will love to work for you. Mm-hmm. Like, if you knew for a fact that you were going to a job that paid you correctly, not like, oh, we're just going to give you just enough to keep coming back. No, if you actually paid people correctly, you would have what you used to have back then. People retiring from being in one place. These days, ain't no honor amongst thieves. When I tell you, I ain't loyal to nothing when it comes down to a 9 to 5. If I want to skidoo, I skidoots. I don't give nobody years anymore because it's not worth it at all. And they know that. But there are some people who feel like, oh, because that's the problem. There's always someone who's grateful for the pennies. That is literally the problem. There's always someone that's grateful for the pennies. And because that collective is so grateful for the pennies, it keeps the circulation going. And then when you got people like me and other people of education, who know better, not so education don't necessarily mean college, but you know better and you've been doing something for a long time and you've seen how it's changed, you're not going for that.
No.
You're not going for that. And even with you going into the medical field yourself, I want you to always stay mindful of the fact that if it don't look right, you leave. You understand? You don't stay in no hostile environments. Mm-hmm. You don't stay in no not up to code environments.
Oh yeah, but that's the not up to code, like that. That's what peeves me. Like, not only are you timed, not even getting checked out fully, but it's also dirty as hell. Some hospitals really just be dirty.
Yeah. And I've seen some clean ones, don't get me wrong.
Yeah. But
I've seen some clean ones.
But if we talk about, like, the healthcare industry as a whole, and then the hospitals, like, and then people being understaffed and just everything happening at once, cleanliness could really be just the last option.
But here's the thing, though.
Unfortunately.
And that's why I was saying to you about the corporation as a collective, because if you paid the cleaning people properly, they they'll do past changing trash cans.
Right.
You know what I mean?
They actually
clean.
Right.
If they were paid properly.
Right.
Because a lot of times, like I said, it's too many people that people complain like, oh, they didn't clean. Now, granted, I don't like that. I don't like it. But I do understand if you're looking at it as, man, this is enough. I'm just doing what I need to do to keep the job, to do whatever I need to do for my family. They ain't paying me, but I'm do just enough to keep it going.
Right.
I'm not going to knock that. I'm not gonna knock that. I don't knock it. And you should take extra precautions anyway. I get one of my biggest pet peeves is when I see patients take their shoes off the step on the scale. I'm like,
oh no, don't do that.
Don't do that. Like,
now you're gonna have sores on your feet.
You know what? I mind my business now. Like, go off. I done told you it's not sanitary. And it's not because I don't clean. It's not getting clean. But after it's still.
I would not.
Just deduct from yourself like 3 pounds. Or, I mean, if you really want to go gung-ho about it, I've put paper towel down for folk or whatever. I'm like, here, just whatever, here, paper towel, whatever.
Yeah, but either way, like, some things you just don't want to touch.
They need disposable everything, even disposable blood pressure cuffs. Like,
yeah,
I think some places
been touching it.
Exactly. I think some places do have disposable ones because I ran into a nurse who was talking about disposable blood pressure cuffs, and I was like, really? Why don't they have that universally for everywhere? Everything, it all should be disposable, literally. Like, it should not be, no one should, because it's like having goodness. It's literally like why some people have that superstition that they will get sicker in the hospital, because guess what? You fucking will.
Mm-hmm.
You will. Imagine patient with MRSA, C. diff, something that's very easily transacted, and the bed wasn't wiped down, and they transfer a new patient in there. They got it.
Yeah, they'd be like, my cousin died after coming from the hospital.
Yeah, that's what a lot of people really be saying.
And they be right most of the time.
And they do.
Be like, I went to the hospital for a checkup and now I got COVID. Why you got COVID? Like, come on now.
Yeah.
And not only that, I just want to, like, we still talk about hospitals, but I want to talk about the correlation to just how it's like everywhere. Everywhere is the same.
Yes.
Everywhere is the same. I worked at Giant. Lord, ghetto, nasty, disgusting, very disgusting. And back to what we were saying about the cleaners. Our cleaners, they barely clean themselves. They push carts, they mop up floors, they barely clean the bathroom, and I can't blame them because they made less than everyone.
They did?
Yes, they did. Made less than everyone.
Oh, that's not cool.
No, it's not. So I can't blame them that they don't clean the walls of the bathroom or nothing. But it's just like, if that's the issue, why don't y'all just hire actual cleaners? Like, the place is dirty. The whole store is disgusting. People come in there and be like, this place is so clean. No, it's not. It's like not clean.
It's like one of them nice and dirty effects.
Right. It's just like, oh, everything looks nice, but if you touch something, your baby go get SARS. I remember this lady let her son crawl on the floor under the cart. The baby's hand is touching the wheel, and so is his head. And the lady's just like, oh, he has autism. That baby's gonna get AIDS.
Don't say that.
I'm sorry. It's just like you just letting the baby touch everything. You're not even worried about him sanitizing his hands or nothing. That baby touched everything. The floor, the cartwheel. Them carts be everywhere. Even near the bathrooms. Do you know what disgusting things you have?
Do you know why I'm so adamant about no shoes in the house?
Just checking
everything everywhere. Girl.
Your shoes are meant for walking around everywhere. You don't know what the heck.
You don't know what you're walking on.
Nope, that's why.
Everywhere. Like, that's no shoes in the house. None. And you eat, like, none. I don't care.
And if you drop some food, immediately in the trash. Can't save it. Can't eat it, can't save it. I'm not even going to wash it off. It's done. It's done. But, yeah, we're going to wrap this up here.
Yeah, so thank you for tuning in and chatting with Thick Nubian Goddess.
With a little snippet.
Yes, it's a little more than a snippet. It's a nice conversations with the Lem. Okay?
And Thick Nubian Goddess.
Period.
All right. Thank y'all.